when a patient has low back pain, what they have to realize, what they should realize is that, number one, there's never one pain generator, hardly ever. It's always multiple pain generators. Remember, folks, you've got big joints there that are covered and housed in ligaments, and there's these ligamentous and fascial and connective tissue attachments all through this back portion of the spine. Then you have this canalway where you have the spinal nerves traveling through. And then you have these little passageways where the individual nerve roots travel through. You can have a compression of the nerve through disc bulging from the front and arthritic changes coming from the back and narrowing passageways through the nerves. The ligaments and joints of the spine, or facet joints, are a common source of back pain. So now you can have multi-level, multi-segmental problems. Flip that spine over and look at it from the front, and you've got discs and you've got vertebral bodies. The disc itself is, the rings and fibers of the disc itself is one of the most sensitive structures in the spine. And when you tear and damage that disc, the disc itself can become painful. So now you have a patient comes in with chronic back pain, with or without buttock, leg, and leg pain. Patients come in with an MRI. Well, I have a disc bulge. I have degenerative. What has that got to do with your pain? That MRI is not a painogram. That MRI just shows you the state of your structural tissues and the state of pathology, but it doesn't show you that one particular area is a painful structure. This is a problem because you can go into the surgeon and say, my back is hurting me, my leg is hurting me. They look up and they say, well, there's a bulging disc, let's intervene. And then they intervene only to find out a year later, when their symptoms persist and the leg pain persists, that it was actually a tear in the disc below the disc bulge, because nobody explored all of the potential pain generators and did a comprehensive job of picking apart piece by piece by piece all those tissue-specific, localized areas that could be causing pain. So patients are getting kind of a raw deal out there because they're going from this practitioner to this practitioner. I was a chiropractor before I went to medical school. I understand the manual medicine world. I studied osteopathic manual medicine after that, and I've spent years with physical therapists. I've been influenced by everyone. And one of the things that I learned is, number one, everyone does it differently. So every single person you go see has a different theory about what causes back pain and what's important. And those experiences have helped me today make decisions about special interventions, because I can see why things didn't work and be able to sort through that diagnostically. I think in summary, what a patient can expect to receive when they come here is hopefully one of the most comprehensive consultations, in-depth consultations that they've had, that has explored their diagnosis down to a target tissue specific diagnosis, where we know exactly what's going on. We have image confirmation of this diagnosis. We have put this all together, and we have now come to a point where let's look at what our options are. Most patients, especially our baby boomer population, they're looking for non-operative methods. They're looking for non-surgical options. And the more advanced this world of interventional regenerative orthopedic medicine grows, and as it is expanding and growing so rapidly, my toolbox is getting so big that we can start selecting and combining various methods to then try to augment and change integrity of joint, structural instability improvement, improved pain, improved function, healing soft tissues, healing ligamentous injuries, and augmenting the healing of tendons, which has been a very difficult thing to do. So all of a sudden, I think now a patient can have a place to come where their orthopedic musculoskeletal aches and pains they can find answers.